So, I hear it's your first time. Or is it really just your first time on your own? Well, regardless of how long you've been on T, or how many times someone else has given you your shot, self-injecting for the first time can be both a scary and triumphant experience.
I was kind of nervous.
I thought it was going to be fine. I thought it would just be kind of like a difficult thing and I would do it.
Before I self-injected the first time, I was in such a sweat, I was in such a flap, I was in such a panic.
I was really nervous that I would do it wrong.
But I was kind of excited too.
I sat there on a picnic table bench for like at least 3 hours with the needle poised right above my thigh.
It felt a lot like the first shot all over again. I was so happy afterwards.
I know it may seem a little nerve-wracking right now, but don't worry. Just think of how much less time you'll spend in the waiting room by taking some of your own healthcare into your own hands. And that leaves more time for fun things like shopping for that perfect tie or cooking a delicious meal for someone special in your life. But first things first, there are a few things you need to know before you start sticking it to yourself with the help of the exquisite Nurse Vivian. We'll help you get set up with the equipment you'll need and guide you through some of the finer points of self-injection. Now, before we get to Nurse Vivian's very handy tips, I'd like to introduce you to a few of my own, well, dandy tips. And by that, more specifically, I mean location. As much as you needed to be ready for your very first T-shot, you need to be ready for your first self-injection. Find things you can do to prepare yourself, like listening to your favorite CD, or taking a warm shower. But remember, even if you find yourself sitting on your cold bathroom floor for 10 hours before you can even bring yourself to drop your pants, you'll only be ready when you're really ready. Next item, finding a safe and comfortable place for your first time. This could possibly mean the bathroom, bedroom, kitchen, living room, by yourself, with someone you care about. You could even dress up for the occasion. Whatever makes you most comfortable. And lastly, testosterone shots are intramuscular injections. Now, in order to get the most bang for your buck, you need to find a big, dense muscle to inject into. The two most common, and likely the easiest areas that guys like to inject, are the quad muscles, also known as your thigh muscles, and the gluteus medius, also known as your butt. The choice is yours. Different people pick different sites for a variety of reasons.
I shoot in my thigh, mostly because it's easiest for me to reach.
I prefer to inject in my ass.
I do it on my upper thigh. I alternate the sites.
Compared to my leg, I don't feel anything in my butt.
So now that we've gone over some of the ways you can get ready for your first self-injection, you're ready to see Nurse Vivian for a practical step-by-step guide.
Hello, gentlemen. Now that you've got yourselves relaxed and ready, I'll get right to the point. First, you need to make sure you have everything you need to get the job done and get the job done right. You will need 2 alcohol swabs, 1 18-gauge needle, and 1 needle 1 1/4 to 1 1/2 inches long with the gauge 21 or 23. Your testosterone, 1 3cc syringe, a Band-Aid, and a sharps container. Always dispose of needles in a sharps container or a non-pierceable container with a lid. Never reuse needles with someone else or on yourself. Traditional needle cleaning methods will not clean syringes which have been used with testosterone. You can get most of these supplies from your drugstore, your healthcare provider, or from some safe injection programs. Now you need to get your syringe ready for that magical moment. Step 1. Twist the 18-gauge needle onto the syringe. Step 2. Roll the vial of tea between your palms. This will warm up the testosterone so that it is easier to draw up into the syringe. Step 3. Wipe the top of the vial with an alcohol swab. Now the next step is a little trick to make it easier to draw up the tea into your syringe. Pull back on the plunger of the syringe until the stopper lines up with the amount of tea that you will be injecting. Then stick the needle into the vial and inject the air into it. This creates extra pressure in the vial that helps to push the tea into the syringe. Step 5. Tilt the vial on an angle so that the tip of the needle is covered with fluid, and slowly draw back the plunger until your syringe is filled with the amount that you need. Step 6. Remove and dispose of the 18 gauge point and replace it with a smaller needle. And finally, step 7. Remove any air bubbles. Holding the syringe upright, tap the syringe until all the air bubbles float to the top. Then slowly push the plunger until a little bit of fluid comes out of the tip of the needle. Now that your needle is ready to go, are you? Always remember to wash your hands with warm soapy water before and after your injection. You've gone through a lot of steps to get to this point, but now you are ready for the task at hand. Injecting into the buttocks is sometimes preferred by trans men because it is a very large muscle. But it can be harder to self-inject due to the fact that you have to twist your body in order to locate your injection site. When injecting into the buttocks, be careful to inject into the correct area. The sciatic nerve runs down the inside of the buttocks and thighs. Injecting into a nerve can cause damage. You want to inject into the upper outer area of the buttock. You can find this area most simply by dividing your butt into 4 quadrants and locating the upper outer quadrant. This is a safe place to inject into. Once you have found your site, put pressure on the area with your finger for a few seconds. This reduces pain when inserting the needle. Next, you want to clean the area with an alcohol swab in an outward circular motion. Remove the cap from the needle. Hold the syringe with a point a few inches away from the skin at a 90-degree angle. Quickly and firmly stick the needle into the muscle. Using your other hand, support the syringe. Pull back slightly on the plunger to check that you are not in a blood vessel. You would see blood appear immediately in the syringe. If there is any blood, it just means you have hit a blood vessel, and you're going to have to remove the needle and start again. If there is no blood, inject slowly and steadily. Remember that testosterone is a fairly thick liquid, and it may take longer to inject than you think. After you're done, remove the needle at a 90-degree angle to your skin. Apply pressure to the site if there is some bleeding, and apply a Band-Aid if necessary. Some bleeding from an intramuscular injection is normal. If you have any concerns, talk to your healthcare provider. If you've chosen to inject into the thigh, it is usually easiest if you are seated. Try and have your feet on the ground and relax your muscle. In order to mark an injection in your thigh, draw an imaginary line down the middle of your leg and then measure 6 inches or 1 hand breadth from your hip towards your knee and from your knee towards your hip. The space between these 2 points on the outer part of the thigh is the zone you are looking for. Again, cleanse it with an alcohol swab, put some pressure on the area, aim the needle at a 90-degree angle, and then stick it firmly and quickly into the muscle. Pull back the plunger to check for blood. If there is any, start again. But if all is clear, proceed with the injection. When you are done, remove the needle at a 90-degree angle and apply pressure and a Band-Aid if you like. So that's it, boys. Now you're ready to call the shots on your own. But if you have any questions or are feeling uncomfortable in any way, please talk to your nurse or your doctor, or talk to a friend who's been self-injecting for a while. And remember, the first few times can be challenging and even a little scary. But I know you can do it.
After the first time I actually did it, I cried.